But the game is telling you that you're bleeding and having injuries. So wrap it up. I mean, in those situations, you know, you gotta do it through your clothes. Oh, jeez. Oh, get the pack. So when a grenade's going off, he might be bleeding out of his ear. He might not be able to hear, be totally disoriented. Might actually kill you. Very cool. Reminds me almost of the game Far Cry, where you can do different types of healing on yourself and take out different objects and the rebarb that we just saw right there. Welcome back to Experts React. It's me, your favorite ER doctor, Dr. Jordan Wagner. Today, we're gonna check out some traumas probably in the game 6 Days in Fallujah. All right, let's check it out.
So you can check for wounds, but you might not actually be hit. You might just not be sure yet.
So he's mentioning not knowing if you've been injured or not, or been shot. Are there situations where that could happen? Yeah, if your adrenaline is like super high and you're in an intense situation, you don't realize it might feel like you got like nudged or a weird feeling that might have hit your body. Even a buddy of mine, if you guys checked out my channel, was shot and didn't realize if he actually got shot or not, but just felt something weird like a push or like an air feeling that he described. If it goes through soft tissue, probably. If it hits your heart, hits your lung, different story. If it hits a bone, again. But you know, there are situations where you may not know it, so just be aware of that. And it was good. It's kind of cool in this game that you can actually check out, like, have I actually been shot? Let me see if there's blood. So pretty impressive. So that's cool. Oh, that's smart. The game actually lets you know if you've been hit. So actually pretty cool. So what the heck is he, putting on the arm? So you have soft tissue injury to the arm. There are actually different types of bandages out there. I am not 100% up to date on the combat bandages that they all use, but there's stuff like Quick Clot and different types of brands where you can actually put this type of special material that has different types of chemicals in them to actually help clot fast, and then obviously wrapping it with a field dressing or different types of dressings out there to help heal faster. It's not necessarily going to heal faster, but it'll probably stop any outward bleeding. So that's the important part. You don't want to bleed out from your wound. You're still going to have a wound. It takes time for wound healing in general. There's no real specific way to help, move that along faster. Maybe to get into a hyperbaric chamber when you're back home could help with wound healing, but not in the field.
The sound design's interesting.
Oh my gosh. So there you go. You got some wounds again, checking for blood. I mean, pretty cool. You got your own, you can see blood, and you obviously injured those people. Bullets, when they're fired, they make lots of noise, and depending on different calibers that you're firing, some are louder than others. And then obviously in this situation, you can have a lot of explosions. So you can get a lot of like ear trauma and damage. So there's like different levels. You can get that ringing in your ears, that annoying ringing. It's called tinnitus. And it could be permanent, it could be temporary. It just has to do with the amount of damage that's occurring in those moments. Now, if the sound is so loud, you can actually cause long-term permanent damage where you can maybe not hear so well, and we'll need to use hearing aids. We'll get random ringing in the ears for no reason, or it might be constant. There's no actual treatment for tinnitus, unfortunately. You just learn how to cope with it and kind of ignore it. Be careful, use ear protection if you can, especially if you're not exactly in this situation, but say you're enjoying target practice, that sort of thing at a range. Make sure you're protecting your ears.
It doesn't sound like it, yeah.
Right, so like here, if you're shooting indoors, it's going to be super loud. You can also get disorientation. You might not actually be able to hear for a short period of time. Be a little confused. So just have to be aware. And they make good ear protection now, even in this situation where you can hear through the earmuffs, because there's an electronic noise canceling basically. So say you put these muffs on and it could protect your ears up to 25 to 28 decibels. But then if there's a loud explosion, it's trying to protect you up to like 85 decibels with the noise canceling. So there is other options out there that they've come up with, and I bet they have even better gear that we don't even know about as civilians. Yeah, you can even hear like the muffled noise, and that's probably the perception of what you're hearing. And you can even see like blurriness, and it's probably just from the brain rattling and just being so disoriented. So pretty good job of like depicting that. But the game is telling you that you're bleeding and having injuries. So wrap it up. I mean, in those situations, you got to do it through your clothes. Obviously worried about infections, but you'll deal with that after the fact. In this situation, your first worry is, okay, let me, stop the bleeding and keep going. You're not worried about digging out bullets out of your leg and doing those other crazy stuff that you see on TV that's not realistic. It's getting shot in the arm, the leg. Could you actually then continue on? Yes, because if it's in the muscle, say you get hit in the quad, right? Well, think about it. The quad is 4. So it's in one muscle, maybe 2. You have other muscles that are intact. impact. So will it hurt like hell? Yes. Will your leg still function? Yes. But say you get shot right in the bone and the bone shatters, different story. Then you have structural issues to where you can't support yourself. But literally I've had people walk in with different types of fractured bones that I thought, how the heck are you walking? And they're still able to walk. You know, your adrenaline's going to kick in this situation. It's probably still going to hurt, but then it's going to hurt a lot later. Those things are perceivable that you can definitely walk on injured limbs if they've been shot, even if the bullet's still in there. The biggest thing, control the bleeding, because that will be the first thing that gets you if you bleed out and then you become, you know, shocky, tachycardic, hypotensive, and then not be able to get yourself out of that situation. Question, how quickly do you bleed out? How quickly can you die kind of idea? It really depends on what vessel's been hit. Is it a vein? Is it an artery? Is it major? Is it, you know, something proximal versus distal? So if you have a major artery that is lacerated, punctured, and you're not controlling the bleeding, it could be a minute or a few minutes that you would bleed out and die. You know, we have people that rupture the aorta, which is the major blood vessel, and most of the time the ruptures happen in the abdomen. If you rupture that and it's an anterior bleed going into your abdomen, it's going to be like a hose of blood coming out, and you're going to lose a lot of your blood volume into the abdomen. And if that's going to happen in 30 seconds to 2 minutes, or so to speak, that's like an average. It's not like exact. It just, again, depends on many factors. You'll die pretty fast. But in these situations where, hey, I got shot in the arm and I can put a quick clot bandage on and hold compression to it and stop the bleeding, then you're okay. And then again, your tissue also will potentially tamponade or cause pressure in that compartment to get the bleeding to stop as well. Now, obviously, you don't want to get compartment syndrome, which is another aspect where you have so much swelling from a traumatic area that you decrease blood flow to the distal parts of that limb. But that, again, typically is due to more crush injuries versus like puncture wounds and bullet injuries. Oh, jeez. Oh, get the pack. So when a grenade's going off, he might be bleeding out of his ear. He might not be able to hear, be totally disoriented. Might actually kill you. The hearing, how long does it take for you to get your hearing back? It just depends. Again, how close you were, how big of an explosion, and then you're going to have ring in your ears, confusion. I love the blurriness where you just basically don't know what's happening. They did a good job with that. And then you got grenade pieces, like shrapnel in the body. I mean, you could try to get the small pieces out, but you just want to wrap it and get out of there so you don't get damaged. Like in this situation, like holy cow, you're having a massive explosion. You're gonna have shrapnel. The force of the explosion won't just mess with your ears. It actually can pop a lung. It can even fracture ribs just from the compressive force of the change in pressures that are around there. So you just have to be fully aware of that. You know, good thing that, you know, you're wearing different protective gear to diffuse the area that's getting all the force. But again, things can pop pretty easily in these situations. And again, if you're bleeding, please try to stop the bleeding. And if you're in a situation that is unsafe while you're trying to fix yourself, make sure you get out of there and then get cover to then bandage yourself up.
Top floor here, I think one's dead.
Oh my gosh. I mean, it seems so exposed in this game. A lot of damage, but I like that you can fix yourself. But it takes a long time to heal. These don't just fix themselves in 2 seconds. It takes weeks for these types of wounds to fix themselves, even months. Well done. Oh my gosh. They're getting blurred, getting shot at yourself. I guess I feel like you should be able to duck, roll, and move a little bit better than what they're showing. But lots of bandages. Make sure, hey, they're proving that you need a lot of medical kits when you're in these situations. So make sure you're prepared.
Amtrak.
Oh man, another exploding injury. You definitely got to be careful. Even those tanks, when things explode, the compressive force, ear injuries, tinnitus, you can't hear as well. They did a good job in this game where it's showing us that you can't really hear very well after these type of explosions. If you get a gunshot wound, I like to call them GSWs, but I know it takes the same amount of time to say that. You first actually want to get out of the situation so you don't die from, you know, secondary injury, right? And then quickly assess what's injured, and if there's bleeding, get the stop. So like we think airway, breathing, circulation. Make sure you've got an airway, make sure you're breathing okay, make sure you got enough blood volume in your body, right? And then stop the bleeding. Circulation is part of breathing, the ABCs. So you want to stop the bleeding ASAP. If you can't get control of the bleeding, then most people have tourniquets on them. But if you're putting a tourniquet on something, you're probably going to make that limb not function the way that it should. So you need to get out of that situation. You're going to run, get cover, get help. But no, what's interesting is he said that the adrenaline rush kicked over him. I feel like people in this situation that are trained don't get that same adrenaline rush. Like ER doctors, we're not adrenaline junkies to where like we do this job because we like the adrenaline. We don't get that response. We're very calm, collected, and focused in these situations. And so same with these individuals, if you ask any of them. If you end up getting shot and maybe feel the pain, you could have an adrenaline type reaction. A normal stress reaction could be, you know, eustress, which is good stress, to where you feel pretty good. Almost like maybe like a runner's high, if anybody's experienced that before. But eventually it'll catch up, because once the norepinephrine, epinephrine, dopamine kind of come back down, then you'll start feeling a little bit more. But in those situations, you know, keep going. But again, these individuals that are trained to do this probably don't have as much of a spike as somebody who wouldn't be like trained to do this. If you've gotten shot in the arm, you can, as long as the arm is functioning, you can use it again and shoot. It just has to do with basically your pain tolerance as an individual, and the functionality of the arm. So if the arm functions, then you just have to deal with the pain or not. Whew. You get hit a lot in this game. I feel like the player, shout out to you for giving us this gameplay, is just being quite aggressive. I don't think you'd be so aggressive in a real situation. You'd be a little bit more calculated, so to speak. You're using the light, you're using it for yourself, but you're also giving yourself up. Getting shot more, causing more damage. I've seen people unfortunately die with 1 bullet wound, and I've seen people survive with 10. It just depends on where they actually hit, what vital structures they hit, and you know, the tolerance of pain as well as caliber of bullet that's actually hitting you. So I still love that you can check for bleeding in this game. You get blurry vision with your injuries, and these guys are just like coated in blood. They take a lot of hits, but very cool. Reminds me almost of the game Far Cry, where you can do different types of healing on yourself and take out different objects, and the rebarb that we just saw right there. So pretty cool. You know, these first person games that you can play with others. I do like in the game that they kind of warn you what's going on. Obviously you can't feel what's happening. You're incapacitated, you're bleeding, you got injured, you were hit. That way you can take a look. But they got these cool rip open bandages to heal your wounds. I'm assuming all these different people have different type of med kits with pain meds in there, as well as a lot of wound dressings, even slings if they need it, and then obviously probably tourniquets as well. It's pretty intense. It's almost like disorienting, just because of like the lighting, and you know, where are you in the room sort of thing. And then there's a lot of stuff going on. It could be quite chaotic. A lot of people will hyperventilate, get pretty tingly, feel like they're gonna pass out. Remember, just slow your breathing down. There's a lot of bandaging. It'd be cool if there were different types of bandages for different types of injuries. That'd be cool to see.
Sweeping for blood, I'm hurt.
Sweeping for blood, I'm hurt, didn't do anything, miraculously healed. So the actions in here, it makes it seem like you heal really fast. It takes a while, especially these amount of like destructive injuries. You know, it takes weeks. When we say you have a laceration and you get sutured shut, the wound closes in 10 days, but the healing of that wound and be strong takes like months for it to be a solid scar that won't just rip right open, and it's got the same strength that it had before. Could you be so shot up that you don't feel anything and you're euphoric but still with it? Possibly, but that would be more of a catecholamine release, aka like norepinephrine, epinephrine, for example, where you're just so you know, enraged with the natural adrenaline in your body that you can keep going because of pain and stress. But once you start losing volume, then that's the shock that I'm talking about, and then it wouldn't be a good thing. I want to see what's actually in these bandages. So, if somebody knows in the comments, leave me a message to let me know exactly what the chemical is in these pre-made bandages that they got. Lots of trauma, lots of injuries to this, where the game itself allows you to keep going. Pretty cool. I actually really liked the effects that you see. It was cool. It was definitely things that we see in the emergency departments, not this involved, but you know, I've had comments in many of the videos that I'm in that I'm a civilian doc working in ERs and trauma centers and don't see these types of injuries, but unfortunately we do. Yep, we have to be trained in every situation, and even the docs that are deployed for the military also train in civilian hospitals as well. So that was awesome. Don't forget to like and subscribe, and check out Experts React on Facebook and YouTube. They got lots of videos, very entertaining, a lot of experts out there. And check me out, Dr. ER, Dr. Jordan Wagner, on all those social media platforms and my YouTube channel.